welcome to another episode of COVID Conversations. Now, in this episode, we have with us Dr. Kunal Sarkar, who is one of the most renowned medical professionals in Kolkata. He's a cardiac surgeon and he's a senior vice chairman of the Medica Group. He's also associated with Asklepia Health, which is an initiative that connects specialist doctors in and around Kolkata with patients for services like telemedicine and live doctor consultation. This interview has been facilitated by Asklepia Health. Thank you so much, Dr. Sarkar, for joining me on this episode, sir. Thank you. So I want to...
Thank you. Thank you for having us. Thanks.
Right. So I want to start with, if I may, about the vaccination drive that is currently underway in the state. Now, firstly, it has been extremely delayed. From May 1st, May 12th, there have been only 2 private hospitals in the state, Woodlands and Apollo Gleneagles, that has been inoculating people within the age of 18 to 44. And that too is happening just in Kolkata. Now, until May 12th, the state government was unable to vaccinate anybody in this age group due to shortage of vaccine. Now, of course, the vaccination has for this age group has started slowly, but even vaccination for people above the age of 45 has also reduced. Do you think this is a worrying aspect? And do you think that the state government specifically is doing everything that they can to speed up the vaccination drive? Or is it just the shortage of vaccine and you think that the state government isn't in a position to do anything else?
I think, it doesn't make for pleasant hearing as an Indian, Piotr, but in the history, in the independent history of this country, the current mess up that we have got ourselves with the vaccination is only comparable to one other event. And that event, in my mind, is the Indo-China War of 1962, when India was caught completely unprepared, literally with its pants down, in the front of a very formidable opposition. Now, you have to spare 2 minutes to understand where the vaccination problem starts. Right. The vaccination problem starts because, probably with very good intentions, the entire hubris of the central government, they were like, they had a spring in their boots, COVID was conquered, we are the largest vaccination center and all that. So they started to act on perception, on beliefs, rather than the ground reality, number one. Number two was that the people, you see, these days you have people gunning for the prime minister, gunning for a certain chief minister, so on and so forth. I am not in the business of defending anybody, but I'm trying to say, because since I am a technocrat and allied to the health specialty, we are able to look at and identify the people. This is like, in college and school, we used to play a game like Call My Bluff, Kam Sharab. That people who have messed it up, people who have slipped big time in giving the real picture to the government are people who are responsible for these programs. In Niti Aayog, etc., you had an apex committee, very powerful body in charge of these. And in their own domain, you see, they are extremely good, well-accredited, sound people. But very few of them actually came with the domain confidence and the domain experience in public health and public vaccination. So the moral of the story is that at the first instance, our plan was to vaccinate with the frontline workers, health workers, senior citizens. The central government said, look, within July, our plan is to vaccinate 30 crore people, which means you require 60 crore vaccines. At the first instance itself, if you look how the Central Apex Committee went around ordering vaccines and getting the supply chain established, they were a complete flop. They were completely lackadaisical, because out of this projected allocation of 60 crores by July, we do not find evidence, any evidence, that anything more than 20 crores were purchased or ordered for time in advance, maximum 20 to 25. So there was a big shortfall there. Now, for the initial months of, say, middle of January, February, March, how were we managing? We were managing because one fellow was located in Pune, the other gentleman is located in Hyderabad. So we were getting ad hoc supplies from them. Supposing this month you were due to get 10 lakhs, you just pick up the phone and give him a bit sounding, and he said, no, give me 20 lakhs. And he gave you 20 lakhs. But he was giving you 20 lakhs by cutting corners, by not supplying people before the Global Vaccine Alliance orders, the Gavi orders, the orders from the other countries he had already on his books. So he was cutting corners by giving you those extra allocations. Now, once the United States and the EU administration sharpened up and they said, we are having none of this nonsense, we are going to take the last vaccine we have ordered for, from that stage itself came the crisis that we had to be content with what we had actually ordered for. So out of the first 60 crores, we only had about 30 crores in hand. Now, till date, we have given about 17 crore vaccine. So from the 30 crores we have ordered initially, we have another 10 to 12 to go. Whilst we were struggling to meet up the demand of that first lot of 30 crores, absolutely in a reckless, in an uninformed manner. And in the meantime, there was also a problem with the raw materials. Under the WTO and the TRIPS agreement, United States was being very mean and very inconsiderate by clamping down on the various plastic peripherals and other stuff.
Right.
Now, whilst all these problems persisted, the government should have recalculated, reordered quickly, reallocated, and come to facts with reality as it stands. They were in complete denial of reality, central government. And I think because, I am no great fan of Prime Minister Modi, but I know he's a perfectly hardworking, intelligent fellow. So somebody must have sold him a big banana skin and told him, you don't worry, you go and announce the 18 to 45 program. Hum log dekh lenge, hum log manage kar lenge. So whilst you are struggling heaven and earth to find 25 crore vaccine, you already have a 50% shortfall in the first stage of your program. You jump the gun and announce the second shot of the program.
Right.
That was a complete, that was a cruel joke on the country. Straight away, give the permission to people like Pfizer, people like Moderna, the Johnson & Johnson, who have got enough trial data behind them, and in a regulated kind of way, make them away, because we have to improve the supply side at the end of the story. And if I may add one more line, which is crucially important, that the first set of people who got terribly nervous by looking at the royal mess this whole thing was, is the government itself. So when in the last week of April, they kind of reformatted the vaccination program, they said something that was absolutely draconian. They said that the central government is only responsible for 50%, the other 50%, the state, the retail, the private players, the big corporates, the panwala, the bhujiawala, the puchkawala, everybody can line up and buy a couple of pieces of vaccine. Now that is ridiculous. United States has 50 states. United States has the big people like Tesla, big people like Amazon, big people like Google, Microsoft. Have you ever in your life heard of a vaccination program done by Google, by Microsoft, by Walmart, by Amazon? You haven't. Even a country of United States proportions, which has 5 vaccines per citizen in its stock at the moment, the entire procurement was done by the government and then distributed down the line to the states, who at the height of the pandemic went on vaccinating people like, a month of Sundays, and they did a grand job of it and got the second wave down. The central government can have a 2-tiered, 3-tiered pricing system. That's not the problem. But the guardian of the program, the aggregator of the program, the conductor of the program has to be the central authority in the country.
So you've made some very, very important points. And given these realities, can we just talk about the situation in Bengal right now?
Bengal had a height of vaccination of around 3. We have a population of around 10 crores. Whatever India does, Bengal is 10% of that, right? Bengal would not have had the intensity of the second wave at the moment. Our second wave is completely sponsored by the courtesy of the Election Commission. 80% of the tragedy is imposed on us by the monstrosity of the 8-phase election. And one of our dear judges, respected judges in the Madras High Court said that the Election Commission should have murder charges in his hands. I would go one step further and say that when the Second World War concluded, you had the Nuremberg trial for the war crimes. Independent India should hold something like the Nuremberg trial for the Election Commission and make it answerable for the agony it imposed upon Uttar Pradesh and Bengal. And those set of sanctimonious idiots who gave permission for the Kumbh Mela should also follow a similar trial and really be hung from a lamppost when the time comes.
So, but is it worrying that the vaccination has slowed down even for the higher age groups? And especially at the time
how can you give it? Like, you mentioned, Priyota, you mentioned about, say, 2 hospitals. I'll name them, Woodlands and Apollo Giving.
Yeah.
Now, look at it. Now, Woodlands, a very respected hospital. I think Woodlands must, so every hospital has a supply line. So Woodlands have mentioned, probably they have managed the supply line because Woodlands has very strong corporate connections. So they must have, through some corporate proper channels. I'm not saying, they are bootlegging vaccines. They are doing a good job of it. But Woodlands is privy to some empowered corporate linkages, which is allowing the supply to come to them, which they are distributing in a very systematic way. It's a paid campaign. Similarly, Apollo. Who is Apollo? Apollo is the largest healthcare network in the country. The largest healthcare network in the country, a power in its own merit, as far as the corporate presence of healthcare is concerned. They must be having, nobody ever in the realms of history has ever heard about individual state governments from a country which has been plundered by the second wave, which has aggravated its own problem, going and lining up to buy, loose pieces of vaccine from somewhere. It's a shame. How on earth did anybody even think of it? It's an absolute shame.
So on May 11th, West Bengal conducted 68,142 tests. And on May 12th, there were 20,377 new cases in the state. The positivity rate in Bengal right now is about 30%. And do you think that not enough testing is happening in the state? And if that is the case, why is that?
Look.
Why is that?
Bengal never tested adequately. Never. Bengal was a genetically slow tester, even from the very first day of the pandemic, the first wave, second wave, whatever wave you look at. And I believe one of the main reasons why Bengal is a very slow tester is, number one, Bengal still doesn't have the enough number of RT-PCR lab it needs to. Because Calcutta, if you look at the Bengal doesn't have that many cities. Most of the RT-PCR infrastructure is located in and around the big cities. So we have reasonable facilities in Kolkata. Kolkata would do with at least 10 more RT-PCR labs. If we were inadequate the first time, we remain inadequate the second time, we remain more inadequate in the second. Why is the positivity rate above 30% in Bengal or above 40% in some states in India? No one in the world, from the depths of Africa to the heights of America, no one in the history of SARS-CoV-2 has ever come across a country which has consistently been more than 40% test positive. We have rewritten the textbooks of epidemiology. You go out 15 minutes out of Kolkata, I think the testing is only 1/3 adequate. There are huge districts which only have one RT-PCR lab.
Absolutely.
The last time since the district penetration apart from North 24 Parganas was very thin, you escape, but you won't escape this time. And the people who are actually coming for testing are the high symptomatic ones. So I
Right.
actually think if I look at the group of people who are actually getting tested, I think, having a what you call a 40% positivity rate is not too bad in that group.
Right. So there's also an acute shortage of ICU beds in Kolkata, both in the government and the private hospitals. Do you think that the state government website, and they've also recently launched this app to check for bed availability and online admissions, do you think that the system is working in your opinion? And do you think that there is a need for a real-time centralized war room similar to what we saw in Maharashtra, specifically the Mumbai model? Do you think that is something that needs to be replicated in Kolkata as well?
A couple of points over here. First of all, I think there is a general truth. And the general truth is whether you are West Bengal, whether you are Maharashtra, whether you are United States, out of 195 countries in the world which has experienced the splendor of COVID in different times and different intensities, to the best of my knowledge, only one country so far had enough clinical capacity to fight with. And that country on the face of the earth is Germany. And apart from Germany, every healthcare system was brought to its knees when it got the full blast of the infection. So the truth of the matter is, you can never fight this problem with beds, ventilators, and ICUs. Maharashtra actually reached its peak somewhere in the first, second week of March. And the whole of March was absolute stampede for them, for cases. But there was, at the height of the stampede, you see, even Maharashtra was looking grossly inadequate for beds. Now, I think the central war room concept is a good concept. What you have said is a very, very critical thing, which is a real-time updation, like what the hotels are doing in the reservation site. Like if you are a centralized hotel reservation site, you have a real-time input from all your hotel subscribers, which gives you a real-time update of the bed capacity. Now, that is what we are crucially lacking in our states. In Bengal, we don't have that at all. In Bengal, if you are a conscientious person, which I'm sure you are, and you say, look, I want to help out people by telling them which beds are available where, you will get fed up because you have to make a phone call to hospital A. That phone will ring for the next 12 minutes. Then some person will answer the phone and give you an answer which is inaccurate. So in this era of information technology, we have to hang our heads in shame in the healthcare industry that we could not get a real-time network update of the bed capacity. And this is accounting for more than half the misery that the common people is going through. That is an extremely good idea. And in trying to prepare for the next wave or whatever, I think this, what you have just said, should be an extremely high priority thing, very high priority thing.
Right. Dr. Sarkar, we also haven't seen an acute oxygen shortage in hospitals in Kolkata. Of course, there isn't enough data for rural districts in the state, but we haven't seen a massive shortage in hospitals, at least, although some smaller hospitals, they have raised SOS for oxygen. Do you think that the increase or the substantial increase in daily cases in the state, do you think that the lack of oxygen could become an issue in the future? Or do you think that as of now we do have enough capacity or resources for oxygen?
Today, the number of critical care beds you have in a hospital is probably double than what you had in the 70s and 80s, double or 3 times. Okay. But they did not upgrade their facilities because by this time they should have replaced the manifolds by either oxygen plants or oxygen tanks. So a good part of the blame also lies with the hospitals who have stuck to the 100 years old technology, number one. Number two, what is happening that whenever the people, whether it is Kolkata, Delhi, wherever, whenever the people have a lack of confidence that should I have a problem with oxygen, with my father, my mother, or my elderly relative becoming breathless and the oxygen falling, will I find a bed? Bed
Hmm.
milega. Now
Hmm.
this is the $1 million question. The moment you feel a bit shaken on this fact, what will be your response? You will just go out, get yourself a couple of cylinders and keep them at home,
Right.
right? So what is happening is all the small cylinders are being stacked up by, I hesitate to use the word hoard because people don't hoard. People just provide themselves for emergency. So people are stacking up a whole lot of small cylinders at home. The moment you have, say, in your area, you have 100 homes stacking up 2 cylinders each, that is 200 cylinders in your area. So very soon, a couple of refilling centers will come up in your area. All the
Hmm.
refilling wallas, they will be buying the big cylinders from which you will fill your small cylinders. And all these big cylinders will come out of the hospital distribution circuit. So
Hmm.
when, supposing I have a nursing home today who used to take 20 big cylinders, say every 2 or 3 days, today I need 20 big cylinders to come in twice a day.
Hmm.
So what will be the problem? You will not find the 20 big cylinders I need, 40 cylinders a day, because
Hmm.
those cylinders are being used in every nook and corner. Every lamppost has become a refilling center. Secondly is to bring those 20 cylinders to you, you will not find the trucks, etc. Right? So oxygen actually has become a biting logistics and organizational issue. Now in Kolkata, in Bengal, uh, two reasons. One is the good part of the bad news is since we have lesser critical care beds compared to many of the larger metropolitan cities, so our per capita oxygen demand is a bit less hospital-wise. And number two, since
Okay.
historically in and around Kolkata you had all this in and around Kolkata, Jamshedpur, the Tata Steel, the Burnpurs, the Durgapur, you have all these huge iron and steel people. And iron and steel people consume a lot of oxygen. And there is
Hmm.
very little difference between industrial grade oxygen and medical grade oxygen. And tell you
Hmm.
one more thing that makes me, a lot of things makes me angry, but this thing makes me exceptionally angry, which is a lot of the big time government hospitals, which have been fed and fattened at the taxpayers' expense. Uh, Many of these big time government hospitals are doing bugger all as far as their participation in the COVID program is concerned. All these 2,000 bedded government hospitals have barely given 50% of their capacity. I want to ask the government what has been the role of SSKM Hospital, the primary teaching tertiary care hospital in the state. I want to ask the state government what has been the role and contribution of SSKM Hospital in COVID care in Kolkata. Give me 2 lines for it.
Hmm.
In a scale of 1 to 10, I think the role of SSK, apart from acting as third umpire in various medical boards, in a scale of 1 to 10, SSK's contribution in COVID care has been -5.
Okay.
They have done nothing. And they eat up and gobble up a large part of the teaching hospital resources that goes to hospitals.
Right. So many
You look at the
experts.
bed.
Hmm. Many
So
experts now, even the medical experts, are calling for lockdown across the country. Do you expect a lockdown in Bengal, and do you think it will do any good?
we are well aware of the fact that the lockdowns are a kind of economic curse, and especially when 80% of Atmanirbhar India's economic activity is in a food, in a hand-to-mouth basis. So a lockdown is a God's own curse as far as this country is concerned, especially after the demonic insults of the demonetization and stuff like that. We are all aware of that fact. But right now, what is happening is, if you want the truth and the blank truth being said to you, if you have 100 requests coming in from patients for admission, I will feel flattered to think if we are able to address 25% of them. So 75% people today who require hospital care, oxygen support, medical attention are not being treated full stop. But there is, whether you call it a lockdown, whether you call it a curfew, whether you call it restriction, today a reckless group of people who have not been very responsible between January and March, if we have to stop them intermingling with one another, what does a lockdown do? It just interrupts the chain of transmission. So if you interrupt the chain of transmission, then instead of having, look, don't trust any government figures that come out from India today. Overall, whether it is West Bengal, whether it is Gujarat, is underreporting death by a factor of 30. If I look at the death rates which are being announced as Bengal, I think they will at least be 2.5 to 3 times, right? Delhi has underreported deaths by probably a factor of 5. And I think the credibility based on, by and large, Indian data now is same as the credibility you associate with the Cartoon Network channel, right? So Indian data is not believed anywhere in the world. I don't think any Indian believes it. So it is what the leaders would like to see. It is not the current condition of the pandemic. There is a difference between the two.
So I want to quickly go through some FAQs with you. Now, there have been reports of a rising trend of what is being called sudden deaths amongst non-critical patients. Now, in this situation, young people are experiencing a sudden dip in oxygen saturation levels and they're dying before treatment can even be provided. Do you have any insights as to why this is happening? And should somebody who's experiencing a fall in their saturation levels suddenly, what should they do?
You see, before we try to give out very clever answers, one thing we have to be very humble about, which is many funny clinical symptoms are happening in the second stage, which we did not see in the first installment. So we have to pretend that we cannot pretend having fathomed the puzzle even 60% so far. One of the reasons the young people are affected more is simply because we have covered the older age group with vaccination. Since we were sloppy people in this first 3 or 4 months, we could not vaccinate the younger people at all, and those youngsters sadly are paying a price for it. The other problem with this thing is that previously there were 2 important things to realize. One is that from our past experience, we thought that much of the trouble with people having these serious complications came after the first week or 5 days. But this time around, that idea has been kind of upset, because many people are showing very virulent disease right up to 2nd and 3rd day. Another funny thing which is happening is people who've been well for 14 days, 15 days, a bit of fever, a bit of niggle have been sent home. People who we would have otherwise thought, theek hai, abhi they can go home. A few of them, not very many, but a few of them have rebounded back with mysterious relapse of the disease in very critically sick conditions. Even we are fumbling for an answer for that. Regarding sudden death, you see, one thing that we have to be very careful about, especially young people, they have young energetic systems. So even if the oxygen saturation is falling, they do not feel very sick. Right. So I have seen people, my colleagues have seen tons and tons of people who are conversing and talking to you almost normally, and you put a bit short of breath, you put a sat monitor on, and once you put a sat monitor on, you look at a saturation of 65, 70, it is dreadfully common. So this has been termed as happy hypoxia in COVID from the very beginning. So the bottom line is, please believe in the saturation monitor more than your symptoms. So that
So
may
you
be one
said
of the
that
reasons.
so you said that in this way we are seeing lesser, cardiac issues in COVID patients,
Yes, yes,
but
yes. Much less.
right, but many patients are developing blood clots also this time, which can be very
Yeah.
dangerous and can lead to heart attacks and aneurysms as well.
Yeah, yeah, yeah. You see, the blood clot is a it is the biggest nuisance of COVID. COVID is not a classical infection because it was well analyzed by the Italians when they were slapped in the face hard sometime in February, March of last year, that when they did a lot of these tissue studies, these people pointed out that COVID doesn't cause us harm by the
Hmm.
classical infection pathway of a bacteria. What COVID does
Hmm.
is it irritates and it disturbs the blood cells, especially the red blood cells. And because it completely annoys the red blood cells, these red blood cells and platelets and the other stuff we have in our circulation, they go on forming these small clots.
Hmm.
They go on forming these small clots, and these small clots will eventually clog up the little microcirculation that was there in the system, preventing the air exchange across the lungs. So I know it is fine print. A sick man is a sick man. A sick man is not terribly bothered whether his
Hmm.
capillaries are clogged up or whether his lung air sacs or alveoli are clogged up.
Hmm.
But it makes a difference to the therapeutic approach.
Right.
Therapeutic.
Hmm.
So forming these tiny clots is a basic pathological feature of COVID.
Hmm.
Now, the other problem I have now, last time around, people were coming with symptoms not so much of heart attack, but this virus affecting the heart muscle as well, what is called viral myocarditis. There are a couple of people I know of who had an ECG would look exactly like a heart attack. And we, in our own mind, thought, "Arey, ye to heart attack hai." We rushed them
Hmm.
straight away for an angiogram and all that and found that it was entirely normal. Then we did a COVID test, it came back positive. But those cardiac problems, and a lot of young women got it. A lot of young, because you see, women get this viral myocarditis anyway, some of them when they are pregnant.
Hmm.
So in peripartum situations, women are a bit more prone to viral myocarditis. A couple of areas where we are sadly lacking now is that in tracking the clinical symptoms, the sickness it is causing, we are still fumbling. We are still fumbling to segregate as to the high risk from the low risk.
Right.
That
So
they're
I.
all this.
Hmm.
Yeah, so that is the segregation and classification of high risk from the low risk is something we are lacking in. And what I think we depend on some bright youngster somewhere to give us the breakthrough is we need in the early phase, very early phase, we need a bang on kind of antiviral, like what penicillin did for the bacteria. So we have to understand the clinical disease a bit better, and we need a very potent antiviral to kick in at a very early stage.
So just one or two more questions. Now, black
Yeah.
fungus is something that is causing a lot of stress amongst people. It's causing a lot of panic.
These are called opportunistic infections, when our immunity is low, when we are fighting for a long time with hefty
Hmm.
antibiotics and steroids and all these things going on in the critical care, then what happens is these organisms which are in the air and in the system that normally our body would not have bothered about is when
Hmm.
our defenses go, when we are on very strong medicine. So these
Hmm.
people creep in from here and there and make their way into the system and starts affecting us, right? So this mucormycosis or the black fungus is one such thing. It looks horrible. once it goes, and if we are a little bit slow to detect it, it causes the most ghastly damage because it does a lot of damage in the intraoral cavities, ocular cavity, and all that. We have to be careful. So people working in the critical care will have to be even more vigilant that how much steroids we are giving the person, whether the whole lot of very powerful antibiotics we are giving the patient, is that causing any opportunistic infections. So all these things we have to be very, very careful about.
Right. So final question, the medical community, they're very divided over the use and administration of plasma therapy as a treatment for COVID. What has been your experience? And should people who've recovered from COVID, should they donate their plasma?
Well, at one point of time, to cut a long story short,